just wanted to say, thanks for having this. This is a great space, and I feel so blessed to be in community with so many amazing fighters. Um, my name is Avi. I'm a man and I was diagnosed with endometriosis last year at my excision surgery. Um, but I probably had a decade. The symptoms showed up when I got my first period when I was 9 years old. And when I was 12, the doctor finally sent me for an ultrasound, and they said, we don't see anything on this ultrasound. You must not have it. Looking, right? They just put me on birth control to be on for years, and that gave me instead of looking into the issue. And so about a decade later, I'm like still having issues and like looking into it, and oh yeah, this is probably endometriosis. Hell, unless they do the laparoscopy and actually go inside and see. So I start looking for an endometriosis surgeon. The first one that I go to, she said, I'm happy to work on you. I would be fine doing your surgery, but I don't think that you would be safe that I do my surgeries at, because it's a Catholic, and I don't think that that you would be safe there as a trans person. So I had to go find another surgeon. Went to a different. They were very confused at first and thought that I was a trans woman trying to get endometriosis surgery, which is a whole other thing, because it being a connective tissue disease, you can get it even if you weren't born with a uterus. So those people are absolutely going undiagnosed. But anyway, they thought that I was a trans woman, and so they didn't want to let me in at all. They eventually assigned me a surgeon, and I saw in her notes that she had referred to me as a transsexual. And I said, I'm not comfortable being referred to that way. That's not really appropriate. And I asked to switch to a different surgeon there, and they said, we'll find you one, and came back a couple days later and said, actually, no, we're just going to drop you as a patient. So I go to my third endometriosis surgeon. This is during the pandemic, so like the wait is crazy, and like there are nurse unions going on strike. So I waited months. I think it was like 5 or 6 months from the first appointment to the actual surgery. And they cut it out. So, I'm doing better than I was then. But the whole thing has been such a radicalizing experience, because I think the framing of healthcare being gendered is so harmful to so many people of different genders, because like the idea of like a women's clinic, instead of just calling it reproductive healthcare, that means that if a cis man gets breast cancer, he's not going to know where to go. He's not going to find out he has breast cancer. If a trans man needs to come in for an OBGYN, if he has the symptoms of endometriosis and needs to find out there's a problem, he's maybe going to be turned away at the desk. They're going to not know what to do with it, because the whole thing is framed around gender rather than around the actual issue that we're working on. And so for every diagnosed patient, there's at least 10 that aren't being diagnosed, because like they're just out there like being told, no, this is just what it's like to have a uterus. This is just what it's like to, they're going to give you a million excuses. So I think this is amazing. I'm really glad that we're able to talk to other endometriosis fighters through this. And I would just encourage anybody who either has a diagnosis or thinks that they might have endometriosis to also talk to their doctors about other connective tissue diseases, because they are highly comorbid. They run together. And I've got 3 that went undiagnosed for decades. So that is probably my biggest suggestion, as well as, trying to find a surgeon that's willing to do excision. And they took out both my tubes at the time, because that was already like a plan that we had, but they found endosalpingiosis. So they did all that, and they very well, I was basically reaching around in the dark trying to find somebody who knew what they were doing. I was lucky. I could have ended up with somebody who, did something that was not what I needed. I could have been put on a medication without having surgery. And I had to do all of this on testosterone with doctors who have no idea how testosterone influences this condition. So I had one OBGYN that I only met with once, because she told me that being on testosterone should cure my endometriosis. And that is absolutely not true. I don't know why some doctors think that, but it does not cure it. It can alleviate some of the symptoms because you're not getting as much estrogen, but that's pretty much the extent of it. I think that, you're talking about fighting the system and trying to get people to get buy-in. I think that, talking about endometriosis as what it is, something that anybody could get. We say that it's rare in people who aren't born with uteruses, but then think about that we only have the diagnosed ones to look at, right? Like if they're not looking for it, they're not going to find it. I would say that our liberations are tied up together, and that we're not going to get each other, and that everyone, that means all of us, and then missed, and they've been missed because of biases that continue to be perpetuated in our society. And I get free without working on those biases. I think that my personal degendering medicine will save lives. And there are lives that have been lost, like people with names, who could have survived if they've been able to go in and get care. So I think that, the next generation of endometriosis education absolutely has to work on, it's silly as it sounds, words are powerful. And the words, in front of a clinic can keep somebody from coming in. Like, it's just the way it is. And we have to, from their little part. And, it's uncomfortable it's uncomfortable the whole way. And that's on purpose because they don't know how to do it, right? Like they don't really care. The medical system is about making money. There are people in it who are doing it, because they that they did it for service, but they're not in charge of the actual healthcare system. So it's so important for our own advocates because a lot of people get sick really young, and if you become as your normal and you even know to advocate, teenagers don't have a whole lot of resources. Someone is listening to this or seeing this and that there's nobody out there who is having the same experience. So many people and they're just not seen. And you're not alone. I don't really know how to wrap up, but thank you for allowing me to speak. I really appreciate the opportunity.